Well, when we think of migraines, we think of a bad headache.
But as Dr. Bruce Hensel reports now, there is another type of migraine that causes unusual symptoms in kids.
Imagine if your child is sick as a dog all the time.
As the days went by, I just kept on throwing up and I got dehydrated, wouldn't eat, wouldn't drink.
I'll vomit up to about 40 times a day, and that's just terrible, terrible for being my age especially.
Both Serena and Olivia suffer from cyclic vomiting syndrome, sometimes called abdominal migraine.
In cyclic vomiting and abdominal migraine, as the word says, that you have disease in cycles or episodes, and that they will often occur with vomiting and nausea, but also abdominal pain, tiredness, and occasionally other symptoms as well, including sometimes headache.
Diagnosing the condition is tricky. It's a situation Serena's mom, who plays a doctor on TV, found herself in.
She had every kind of scan you could think of, upper GIs and CT scans and delayed gastric emptying tests and, blood work constantly.
Some of them have had over 100 such episodes before somebody figured out what it was that caused the trouble. And unfortunately, probably most people out there with this condition still haven't recognized it for what it is.
Dr. Richard Bowles has zeroed in on changes inside cells that might cause the problem.
It's really the nerve cells which require the most energy, and disease occurs at times of energy demand. This is a real disorder, that it's a real physical cause, that it's not in your mind, and that treatments are usually, not always, but usually quite successful.
Once diagnosed, treatments include prescription and over-the-counter medicines.
A particular medication, amitriptyline, which is now considered the standard of care with mitochondrial disease, coupled with coenzyme Q10, which is an over-the-counter remedy that you can take that increases energy supply to some degree.
It's turned Serena's life around.
Everything seems a lot better. I'm back where I used to be.